That's where people get the big wave of dizziness that passes over them, where you feel really unsteady. Vision goes with your head and then jumps back to the target. The good news, it can get better. Hey you guys, Dr. Jonny Crowder here from Neuroathletic PT, and today we're going to be talking about why your eyes can't keep up and what you can do to fix it. So, why your eyes can't keep up has everything to do with the vestibular ocular reflex. But what does this mean to you? Alright, so here's the symptoms that you'll typically feel. When you turn your head and move quickly, do you get the sensation that your visual field blurs? Do you get a wave of dizziness that passes over you? When you do changes in head position, do you feel dizzy? The common places people feel this are when they lay down, they feel dizzy. When they sit up quickly, they feel dizzy. When they stand up, they feel dizzy. When they look in an upper cabinet or change a light bulb, they feel dizzy. When they bend down to pick something up off the floor quickly, they feel dizzy. When they turn around to talk to somebody, they feel dizzy. Those are all likely problems with your vestibular ocular reflex. In the inner ear, they both fire at a resting rate. When you turn your head one way, that activates that side and inhibits the other side. So if I'm turning my head this way, what that does is it should trigger an equal and opposite direction. That is what the vestibular ocular reflex should be doing. But across the lifespan, there are so many medications and disease processes and problems people can encounter that will decrease the function of your inner ear. Now, when that happens and your head moves one way quickly, your eyes don't maintain perfect steady gaze. When your eyes don't stay perfectly focused on the target that you're looking at and you turn your head, what happens? Your vision goes with your head and then jumps back to the target that you're trying to look at. When you have that rapid eye movement, that's where people get the big wave of dizziness that passes over them, where you feel really unsteady for just a second or two. This specifically shouldn't make you feel dizzy all day long and always be miserable, but anytime you change and move your body, that's when you're going to be feeling this type of dizziness. The good news, it can get better and you can improve it. Please look at all my other videos on how to examine and evaluate to make sure that this is the problem that you have. But if this is the problem that you have, the treatment for gaze stability is fairly simple, kind of boring, but highly effective. And so as you do these, here's what we're going to do. You're going to have a target that you're going to hold out in front of you. I recommend that you put a letter on a note card or a sticky note, something like that. And then you're going to hold it out in front of you. If it's on a sticky note, you can stick it on a wall, sit in front of the wall and look at the wall. Holding it doesn't matter. As long as you have a target in front of you that you can see really clearly and have good focus on. I recommend making it a letter. That way, if it starts to have impairments and blur and move and shift, you can detect it. Sometimes when people put a big dot on there, it's hard to necessarily see when you're having a problem and when you're not having a problem. And so this is called the Vestibular Ocular Reflex 1. VOR1 is the name of the exercise. So you hold your target out in front of you, your chin tips slightly downward, and then you're going to be turning your head left and right, keeping your eyes focused on the target. Technically, your head should only turn about 20 to 30 degrees to each side. Not more, not less. You don't want to hurt your neck. You're not whipping your head back and forth. You also can't do it super small. And so when I talk to my patients, I recommend turn your head back and forth enough that people could tell you are disappointed and you are telling them no. If you're moving your head so small that a little kid couldn't tell that you're saying no, or you're whipping your head so big that you're causing neck pain, you're doing it wrong. And so I recommend look in a mirror, look at yourself and see, is this enough movement that everybody would know that I'm telling them no? Is it too small or too big? If you ever get neck pain, do it smaller, or you might need to see a therapist to also look at your neck pain separately because you could have orthopedic problems that could be limiting your neck from moving very well. But this as a whole should not ever be painful for you. Now, how fast are you going to do this exercise? I recommend using a metronome. There are several free apps on the app stores that have metronomes. If you get on Google and just type the word metronome, you can pull up a metronome on Google on the homepage, and you can set the speed. Now, the speed is important because it lets us progress how you're doing on the exercise, and are you improving or are you not improving? And so I'll have people pick a speed because you want to do this exercise for a minute at a time. As you're doing this exercise for 1 minute, you're going to keep your eyes perfectly focused on the target, and you do a minute. How do you know you've done it at the right speed? Now, that's where if you set a metronome, if you do it and you feel like my head movement is perfectly steady, okay, it might be easy. Now, if the target stays perfectly clear in your vision, it doesn't blur, it doesn't move, it doesn't shift, and you say it's perfect, it might be too slow for you. Because again, this is like you want the perfect amount. You don't want it to be too fast. You don't want it to be too slow. Too slow is not helpful. Too fast, it can give you a lot of symptoms. We want it just right in the middle. So as you're turning your head and you do it for the full minute while you're looking at the target, if you feel like you start kind of bobbling your head and your head gets a little bit jerky and you feel uncoordinated, that tells me you're going so fast that your inner ear is struggling to keep up, and it's likely working at its highest capacity, that your neck muscles start tensing up to try to compensate and help with the stability. Now, if you get a little bit of that, that's what we're looking for. If you feel like your head starts jerking and bobbling all over the place, it's probably a little bit too much and you need to slow it down a little bit. For clarity, the other part of it, if you're turning your head and it stays perfectly clear, too slow. If you're shaking your head so fast that you can't even see what letters on the note card that you have, too fast. You want the target that you're looking at to feel mostly steady, maybe blur and shift and move a little bit. That's the target that we're looking for that perfect middle ground. And we do this a minute at a time. Now, depending on what's causing your lack of gaze stability, often from a vestibular hypofunction, well, you need to actually be diagnosed properly. Do you have a unilateral, bilateral, and is it acute or chronic? Those are the questions we're going to ask because that significantly impacts how much you're going to be doing this exercise. For an acute, so it just started, one-sided deficit, you're going to be doing this for 1 minute, a total of 12 repetitions a day. I'd ideally have you split it up across 3 to 4 times. So either 3 repetitions 4 times a day or 4 repetitions 3 times a day. Either way, it's really up to your preference. If it's acute and both sides, it's going to be 20 total minutes a day. So it's going to be quite a bit more. So you'll do 5 repetitions of 1 minute 4 times a day. Now, if this is chronic and you've been having this problem for a long time, now it's going to be 20 minutes all the way up to 40 minutes, depending on if it's unilateral or bilateral. And so you're going to be holding that card and turning your head left and right. I have to give you a warning. Even though that's the ideal training volume to get you the best, the fastest, a lot of people can't tolerate and handle doing it that much. And so if you feel like this is making me too tired, too dizzy, too nauseated, too sick, it's okay to work your way up to that slowly, but you want to try your best to work up to those volumes because those volumes get you the best, the fastest, but sometimes you just can't tolerate that yet, and that's okay. And so to summarize in this video, why your eyes can't keep up and how you can fix it, you probably have a vestibular hypofunction, and for some reason or another, the signal from your inner ear is not going to your brain all the way. And so it's not keeping what you look at staying perfectly crisp, clear, and steady. As a result, you feel afraid of moving, you feel dizzy, you start moving slower, and that's not what we want for you and for your life. So please, do exercises like the vestibular ocular reflex if guided by your therapist or medical providers, and try to work on making that dizziness better so you can live a full, good, and fast-moving life. If you like this content, please subscribe to the channel, and I'll look forward to seeing you again soon.